Hello everyone, I am Fatima Fitz and I would like to thank the ICS Scientific Committee for the opportunity to present my study results. This work was accomplished during a research fellowship at the Incontinence and Age Laboratory in Montreal, Canada. My presentation is Impact of an Urgent Desire to Void on Trunk and Pelvis Movement in Older Women with Urinary Incontinence and History of Falls. We declare there are no conflicts of interest in relation to this presentation. Urgency and mixed urinary incontinence are associated with an increased risk of falls among elderly women. The increase in bladder sensation, urgency, is hypothesized to be associated with changes in trunk muscle activity. This suggests a potential association between continence control, postural stability, and gait. So, the aim of the study is to investigate the effect of an urgent desire to void on trunk and pelvis movement during assessment of gait kinematics in older women with urgency and mixed urinary incontinence who had experienced falls. This is an observational pilot study undertaken with 2 groups of healthy community dwelling women aged 65 and over who experienced at least one fall in the last 12 months. The incontinent group had moderate to severe urgency and mixed urinary incontinence by ICQ-UISF and most equal 3 urine leakages per week in the 7-day bladder diary with at least 1 urgency-related leakage. And the continent group had an ICQ-UISF score equal to 0, no renal leakage report in the past year, and in the 7-day bladder diary. The gait kinematics parameters evaluated were gait speed, stride length, and stride width. And the total amplitude of trunk and pelvis movement were trunk and pelvis center of mass in mediolateral and anteroposterior positions. Gait kinematics were assessed using emotional analysis systems with markers placed on the participants' feet, shanks, pelvis, and trunk, and participants walking on the instrument treadmill. Participants drank water until they reported feeling an urgent desire to void determined by a score 3 on the urinary sensation scale. After, they walked on the treadmill for 20 consecutive gait cycles and then to go to the toilet to empty the bladder. Immediately after emptying their bladder, the participants with no desire to void walked again on the treadmill for 20 consecutive gait cycles. The mean and the standard deviation of the gait parameters and of the total amplitude of trunk and pelvis movements were calculated for both groups. 30 women participated in the study, 60 continent and 40 incontinent. Both groups were similar in terms of age and Montreal Cognitive Assessment Test score, and the body mass index was significantly different between groups in favor of the continent group. In the gait parameters, there was no interaction between groups and bladder condition. The groups were different for gait parameters, the incontinent group having a smaller stride length and a larger step width. Regarding trunk and pelvis movement parameter, there was interaction effect between groups and bladder condition for trunk and pelvis center of mass mediolateral movement with reduced displacement in the mediolateral direction of the trunk and pelvis during gait in the incontinent women when experiencing an urgent desire to void. This is the first study that reports influence of an urgent desire to void on trunk and pelvis movement during gait, and the gait pattern observed in the incontinent group, smaller stride length, larger step width, and reduced movement of trunk and pelvis mediolateral displacement suggests an attempt to maintain the urinary continence. And this trunk and pelvis stiffness may also result in reduced posture correction capacity and right risk of falls. Thank you for your attention.